So is Dr. Yeah. So Dr. Bhuvneshwaran, his topic is levofloxacin as a replacement to ethambutol in anti-TB regimen for ocular tuberculosis.
Good afternoon and all. I'll be talking on the topic levofloxacin as a replacement for ethambutol in ATT regimen in ocular tuberculosis. I don't have any financial interest. So, and ATT, it started with the discovery of streptomycin, and since then newer antibiotics have been developed. People have been trying to cure TB in whatever known ways possible. Even the current standard the TB regimen which has been suggested by the WHO faces one problem which has been consistent throughout, which is the patient compliance. So that is why they recommend direct supervised medications to the patient. So this is in Indian scenario. We have the intraocular TB is classified under extrapulmonary TB, and we treat it with 2 months of isoniazid, rifampicin, ethambutol, and pyrazinamide, followed by 7 months of maintenance phase, which is rifampicin and isoniazid alone. In our study, we propose the efficiency of levofloxacin as a instead of ethambutol. So it's an observational study on 23 patients for whom levofloxacin was prescribed instead of ethambutol. So why? What is the difference between these two drugs? One is ethambutol is obviously a first line drug, but whereas levofloxacin is obviously a second line drug. But ethambutol, it is a tuberculostatic drug, whereas levofloxacin is a bactericidal drug. The side effect of ethambutol, why we are trying to avoid ethambutol, is primarily the patient has come for a visual complaint, and the risk of patient having color vision loss or field defect, developing optic neuritis is a bit more than it is because of ethambutol we see in patients treated with ATT. Whereas these side effects are not there in levofloxacin, whereas are pretty less in levofloxacin. Whereas in ethambutol, the advantage is it prevents resistance and sputum conversion. In our patients, we had a data of 23 patients, predominantly male. Average age was 30. Majority of our patients were bilateral patients, and these are the uveitic conditions in whom TB was found, and TB was found based on these investigations according to the standard flow chart. And we had given the patients the treatment was started by a pulmonologist, and it was based on the age and weight of the patient. The patient also received oral steroids and MMF or azoran from ophthalmologic point of view for the control of inflammation. When I submitted this thing, we had a follow-up period of 3 to 17 months period in these 23 patients. None of the patients had a reactivation of uveitis during the follow-up. So even globally, there are people are trying newer regimens for TB for better patient compliance. So in our I conclude that levofloxacin is a viable alternative to ethambutol in treatment of ocular TB. Though the study favors levofloxacin, its effect on systemic disease needs to be evaluated. These are my references. Thank you.
Okay. So, what about the systemic disease? Because you have replaced a drug. So, the ophthalmic you feel became much better. What about the systemic disease?
We are following up the patients, ma'am. They are doing well till now, but a larger sample size and prolonged period of systemic evaluation. If you have seen, my follow-up period is pretty much less.
Right.
At that
so
point in time,
further
the patients are still being followed up.
The systemic is also getting better with the
they are doing well till now.
All right.
See, I am all for new things, but the essential issue here is that you are using a second line drug as a first line drug, and you are using it in ocular tuberculosis, which predominantly is a paucivacillary disease.
True, sir. And moreover, I am doing it in a TB prevalent society where ethambutol is the drug which is proven to say that TB conversion rates are better. I'm telling you, I'm using it only in ocular TB, not in pulmonary TB cases. predominantly ocular TB, and the patients are being followed up with a pulmonary chest physician also, who is prescribing the drug. He is taking care of it systemically. He is following up the patient systemically. I am concerned about the ocular disease, where I have seen the risk of patients having color vision, contrast problems, and developing optic neuritis have diminished.
All right, so we get it, because any eye disease we don't like to give ethambutol. It's okay. Thank you.
Thank you.